we'll get started. So thank you again for joining us today. First, introduce myself. My name is Julie Sun. I am a consultant with Guidehouse supporting the CDC's One Lab initiative. I just want to cover a few housekeeping items before we dive in today. So at any moment, if you are experiencing any technical difficulties with Zoom, please contact our OneLab inbox for support. That's onelab@cdc.gov. We'll also paste that email address in the chat for us there. Additionally, if you have any questions during today's presentation, please utilize our Q&A function. You'll see the icon at the bottom of your screen, the Q&A icon. Please post your questions there. We'll have a Q&A session at the end of the presentation, and we'll do our best to answer all of your questions. And then next, we also will be posting a link to live captions in our chat. We ask that if you are utilizing the live captions please keep both the captions window and the Zoom event windows open to follow along. So with that, next slide, please. I briefly want to go over today's agenda. So we'll be starting off with discussing some new and relevant resources from the One Lab, and then get into introductions to today's presenters. And after that, we will have a wonderful presentation from Mr. Mike Barron. And again, we'll have about 10 minutes for a Q&A session. We'll most likely get through as many of the questions as we can during that session. And then we'll wrap off and close today's sessions with a list of upcoming One Lab Network events. Next slide, please. And then for today's session, we'll be enabling our chat feature here. We encourage you all to use this feature to connect with each other, as well as utilize the reactions. We do ask that you please be mindful of these rules of engagement on the screen here. And if you do have questions for our presenter directly, to please utilize our Q&A function and not the chat feature so that we're able to track your questions. We ask that you please always show respect and professionalism, and that you remain on topic with today's session. And then if there are any issues, please let a moderator that is monitoring the chat know and report any issues to us via that email address shared earlier. So with that, I will be turning this over to our One Lab Network lead, Alicia Branch, to discuss our new and relevant resources. Thank you.
Thank you, Julie. Before we begin the main presentation, I'd like to share a new One Lab resource. It's the Routine Microscopy Procedures e-learning course. It's now available on One Lab Reach. This is an introductory course, e-learning course. It covers microscopy procedures for smear preparation, preparing and interpreting results from like gram stains, wet mount, potassium hydroxide, and Indian ink procedures. It is an excellent course for microbiology and science students, new or existing clinical and public health laboratory professionals, or anyone who kind of needs some basic microscopy e-learning training or refresher training. The course is approved for 1.5 contact hours of PACE credit. To access the course, scan or snap a picture of the QR code and take the course after today's webinar. Now I'll read two, next slide, please. I'll read two disclaimers. The first one is our CDC disclaimer, and then the second one will be the PACE disclaimer. Slide decks may contain presentation material from panelists who may not necessarily be affiliated with CDC. Presentation content from external panelists may not necessarily reflect CDC's official position on the topics covered. Next slide, please. CDC, our planners, our presenters wish to disclose that we have no financial interests or other relationships with manufacturers of commercial products, suppliers of commercial services, or commercial supports. Next slide, please. And now I am really excited to introduce our One Lab Network presenter, Mr. Mike Barron. Mike has been the executive director of laboratory operations for the Wisconsin Diagnostic Laboratories for over 6 years and has worked in the clinical and laboratory field for 33 years. He has implemented numerous alternative staffing solutions to meet the Wisconsin Diagnostic Laboratories staffing needs. He's a retired U.S. Army Reserve Lieutenant Colonel with various leadership roles in the armed forces. He has led the Wisconsin Diagnostic Laboratories through the ISO 15189 accreditation and is one of the recipients of the Medical Laboratory Observers 2024 Lab of the Year Runner-Up Awards. He has much passion for sharing various staffing solutions to keep your laboratory from being short-staffed. As with the Wisconsin Diagnostic Laboratory, noting an impressive 4% vacancy rate. Our presenter for today is Mr. Mike Barron.
Hello, all. Welcome, and thank you for giving me this opportunity to speak with you all this morning, coming here from Milwaukee, Wisconsin. I'm going to be working on sharing my screen here as I'm speaking. So here's the topic, as you mentioned. A couple other kind of messaging to share is if you have any more interest in this topic. I've been published a couple times in different laboratory magazines if you want to read about it further. Most notable was CAP Today for the August 2022 edition, on the first article in that magazine, and more recently the Dark Report, if you receive that magazine, or they also give you a reference. You get a PDF file of the actual report from April 29, 2024, so more recent. As you can see here, I have my key agenda topics up for today's discussion. Like they mentioned, I have a lot of passion for staffings in the laboratory. Currently, my lab does not have a single temporary employee within the laboratory. We're able to staff within our own team members and train them appropriately, and you'll see how we get that accomplished. First off is as you can see here, the key topics we'll talk about gaining awareness of working in the clinical lab early on. I note that that's always a challenge, and I've done studies in audits where we're finding that most folks don't even know this career even exists. So we're trying to change that. You know, how can you attract these quality team members? I also instilled several programs in the laboratory. The most notable is the non-certified tech program, which I'll talk about more in depth, and the apprenticeship program with the state of Wisconsin, which I'll talk about, is maybe something you can consider with the state that you're from. And if you're from Wisconsin, this program is available for you. We'll talk about training commitment and resources involved in this. And one program that we're in the process of rolling out is a medical lab assistance program. And then there's some additional NCT programs that I have been working on in the lab. All right, as you all aware, staffing shortage in the clinical lab is not probably new to any of you all. You're all probably addressing different staffing issues or crisis potentially within the lab. There's an extreme shortage of certified folks available. So the first thing that I've been working on is gaining awareness in this career choice within the clinical lab. That is a challenge for us all because we are dealing with the limited number of certified techs available through the different college programs. So one thing here first is I encourage you to support your local colleges. Here in Milwaukee, we have UW Milwaukee, we have Marquette University, we have the Milwaukee Area Technical College, which all have different programs, either a CLS or MLT program, which we provide internship for these folks. And more than not, they end up coming to our laboratory after we spend the time with them in the laboratory, learning our laboratory as part of their curriculum. So if you have the ability, I know some labs struggle with bringing outside students in to give them this internship opportunity, but it is a feeder process for your laboratory. So if at all possible, please work it out. I know the challenges that can be associated with that, but I think the challenges pay off in the long run when you bring those folks in, especially when they're trained within your laboratory. The other thing that I've done successfully is I've made connections with the Department of Public Instruction here in Wisconsin and working on developing relationships and creating programs. Most notably, we're working on creating a lab assistant and a phlebotomy program, more of a student apprenticeship program for high schoolers in the junior senior year, which you can get them in your laboratory early, actually get them to perform work in the lab early on. So I think it's beneficial for the student and the school, and also gains interest of the student right off the front. Some of you might be aware of HOSA, Future Health Professional. It's a program that's nationwide. I support the local Wisconsin chapters through the state of Wisconsin. I've spoke at this recent conference. We also had a booth there talking to students. There was over 1,100, I believe, students at this conference. So reaching a lot of folks and teaching them about the clinical lab career. I spoke about the clinical lab career in a session within the conference that they support. So it's a great opportunity to pass the word. Most people are aware of ACLS and the conferences they have. Here again, we supported the ACLS conference in the state of Wisconsin. We had a booth, and there again, we had speakers. I spoke last year about the career, and we had several speakers from Wisconsin Diagnostics Lab at the conference this year to help present our lab and what we offer, and just presenting to folks, in the clinical lab field, some of the solutions that they can have for staffing or other areas within the laboratory. Like I mentioned before, youth apprenticeship programs, they're offered more abundantly than I was aware of. The Milwaukee Public School System has a youth apprenticeship program where we could bring in students into somewhere similar to our MLA program and get them experience on the job. Actually, get them started working on a career here in the laboratory as a high school student. There's also private schools that we've been discovering also that have this opportunity. There again, it's a challenge to bring these folks in. You got to spend time with them. However, I think it'll pay dividends when these folks get that experience in your laboratory and they want to come to your lab as a permanent employee. Also, I've spoken at different conferences throughout the state, most notably the Wisconsin Clinical Lab Network. Your state may have similar type of network where there's clinical lab folks that speak about different topics in the lab. And I spoke about our staffing solutions and some of the things that we bring here at WDL. Wisconsin State Lab of Hygiene is more of our state laboratory, and they have a bunch of communication that goes out throughout the state, which I was able to communicate some of these staffing solutions, as well as the apprenticeship program for laboratories to use within the state of Wisconsin. So another resource for awareness. And then, most notably, obviously, as you all probably participate in different college or even local job fairs. There again, it may not be necessarily gaining immediate placement of folks, but you're passing the word and making people familiar. There's a lot of college students out there not sure what to do, and you give them an opportunity to talk about the clinical lab field. So the big part of it is ACLS believes, as you can see here, that education is an important part of it. As you'll discover in my non-certified tech program, I take this to heart, and a part of our program is providing students with classroom instruction. And that's what I'll be talking about here in the coming slides. So part of this is attracting qualified lab team members. And who are these folks? Where do they come from? There's many. In fact, before I rolled out my non-certified tech program, I reached out through a blind ad for college students with biology, chemistry, or related type degrees interested working in the clinical lab. And I had many resumes coming through on this interest. Even though it was kind of a blind job, it wasn't even a true job. It was kind of determining what interests we had. So when we put out advertisements for non-certified techs working in the clinical lab with these backgrounds, so what we're hiring into these roles or candidates that we're looking for are strong science students that have a transcript that shows that the CLIA 88 requirements. They have the certain course load in biology, chemistry, and so forth. I'm not sure what those requirements are off the top of my head, but we evaluate that through HR, and the manager teams, review these transcripts, review the resume, and truly we get, when you put out an ad for an opening in the laboratory, we get dozens and dozens of resumes, and we get to pick through the best of these candidates, as opposed to if you put an ad out for a certified clinical lab scientist. A lot of times you're lucky to get a single resume, if at any. So it does open the door for a lot more candidates, but there is some work that goes into getting these folks up to speed. However, we are finding that you get high quality candidates that you can mold and develop into the clinical lab scientist that works within your laboratory. So we afford them that on-the-job experience as they come in, and we give them education in the laboratory. More notably, I hired in a lab trainer whose whole mission is to develop clinical lab curriculum. So they're giving them classroom instructions. So they're going to class as well as working. We pay them for both their time in the classroom as well as in the laboratory. So we're basically handing a career to a college graduate that may not necessarily know what they're going to do with that biology degree or chemistry degree. It's not real clear cut where you're going to go. And honestly, I was one of those students back in the late 80s where I came out of college and didn't really know what I wanted to do. And I was afforded this opportunity through a local laboratory. So main motivation for creating this program was my even past experience. And we do, part of that classroom is we prepare them for the AACP certification. Since we're training them in specific specialties, we're basically going through the AACP route because they offer certification in the specialty area. As you can see on my letters after my name, I'm CAACP, so I'm certified in clinical chemistry only, not as a clinical lab scientist with a generalist background. So that's how I started my career in the chemistry department. Got classroom instruction, had my year experience, then became AC certified after that first year experience on the job. So what led me to where I'm at now to develop this program within my own laboratory, and found it to be a specific need. We were in a big struggle, especially on second shift, which, to be honest with you, most of our second shift now are non-certified techs that become certified, or different degrees of training and education within our laboratory. So like I said, the non-certified program, we recruit graduates with bachelor's degree with meeting the CLIA requirements. We do pay these folks, like I mentioned before. We pay them a non-certified tech salary, which is a good entry level type pay for a college graduate. Once they become certified, we immediately promote them and give them the increase in pay to become a clinical lab scientist at that point. My decision is to name them as a clinical lab scientist within the laboratory, even though they're certified in a single specialty. Our laboratory is large enough where they generally only work in a single specialty area. So I didn't want to create a caste system where folks are either generalists or certified in a single area. So we treat them all equally. So like I said, on-the-job training, classroom instruction, and then ACB certification is what we provide, or we provide the education to achieve that certification after 1 year. So that's what the requirement is: a bachelor's degree, 1 year experience at an accredited laboratory. You can become certified after a single year. Our expectation is that these folks gain their certification. We encourage them to apply for the certification immediately when they're eligible. and take the exam early while the knowledge is still fresh in their head. But we give them up to 24 to 30 months to gain the certification. So it's not a lifelong position for us. If you're unable to get certified within that period of time, we ask to either move on or select a role within the laboratory that they're eligible for. They meet the requirements. A lot of times that'd be moving down to a lab assistant, which we also, would hope that they would continue the certification process. As you know, to gain certification, you can take the exam more than one time. So that period of time, they generally have enough time to get at least 3 attempts under their belt. But we've had that happen with one of our candidates, but for the most part, most of them getting in the first try and some in the second try, just if you're wondering. So pros and cons to this non-certified tech program, obviously there's both. One of the things I mentioned immediately is we get a lot of candidates. We get a good selection pool of folks and very engaged, very smart and motivated individuals that we can select from. Because they have that educational background in biology, chemistry, they generally have a good solid background and learn the laboratory quickly. We're really training them on the clinical lab specific stuff in the classroom instruction. Entry pay is until they achieve certification. So it's lower cost labor, I guess, initially, but we don't look at it that way. We look at it as an opportunity to train them. They're bringing value to themselves and the laboratory during that time. And then like I said, we've noticed good success with folks learning the material, learning the clinical lab environment, learning the lingo, the language, and working well with the clinical lab scientists that have gone through the traditional route. Like cons, like I mentioned, they generally get certified in the generalist, not in the generalist area, but in a specific specialty field. Most of our folks are taking second and third shift in the core area, so we're encouraging them and we're training them in chemistry and hematology, which includes the urinalysis and coagulation. So really encouraging them to gain certification in both specialties is for their advantage on the long run. If they decide to leave WDL, go elsewhere, that'll probably put them in a better place. And like con is there's no guarantee. We put this time and energy, we train them, we pay them, and they don't necessarily need to stay around. We don't necessarily, think they'll stick around. We hope they are. We hope there is some loyalty and respect that they gain from our laboratory from the efforts we put forth. So, what also I was talking about previously is the apprenticeship program. I didn't speak much about that. I talked about the program here where we train them on the job. The other alternative, which I've created with the Department of Public Force in Wisconsin, Workforce Development, is an apprenticeship program. So we created a draft contract that any laboratory in the state of Wisconsin can pick up and contract with a candidate and a local university. So the big advantage here for labs that can't afford to pay a trainer or have the workforce to support training, this arrangement with the local university, and we work with the Milwaukee Area Technical College for chemistry and hematology. It equates to 2 semesters, which works out well because it fits within that year time frame that they need to become eligible for certification. They take the coursework at the school. We pay them for the time they're going to school and the travel back and forth. We also pay for their parking, books, and the tuition fees. So big benefit to them. They get total credit for the college coursework, the credits that they gain from the college. They have a college transcript that supports the education they achieved. We pay them for it, and it's really good education for them. So it works well. The differences between that, and I'll probably have another slide that talks more about it. Let me move forward then. So the apprenticeship program is, like I was mentioning, there's pros and cons. The biggest pro to this is that you don't have to pay for that. Well, you do pay for the training, or you don't have to. It all depends on how you want to set it up. We chose to pay for the tuition, which from an expense standpoint, the amount of money it takes to develop a new person in your laboratory, it's actually inexpensive. Also, the state can reimburse you, offset some of the tuition costs. Some of the states have some grant money available. In the case of Wisconsin, it's $3,500 per student. So that in this case here would pay for their tuition. So not much of a concern in that regard. The limited con part of it is that the classroom instruction doesn't necessarily correlate as well as we're able to do with our own trainer, what area of the lab they're working in. They might be working in chemistry, but this semester they're working in hematology. So you're not gonna, have that equal correlation to it. And some of the students mentioned concerns about that. It's like, yeah, it would have been better if it would have been great, at the same time, like you have in college, you have your lab, which correlates with the classroom instruction you have. But not if you don't have that flexibility. So that's some of the cons associated with that. But it's a good option and it works. And if you can work it out with your state, it's something very valuable to you. And they get great education through the local university. Move forward. So benefits, development of a non-certified tech. What are some of the benefits? So like I kind of repeating myself here. You can fill your ranks very quickly. You can focus in on your lab needs immediately. So basically what we do is we hire in the non-certs in the program. And it's a challenge to my trainer, but we hire them as we need them. And she works them in the curriculum where she's at and tries to group them together the best she can to get them through the training. But she has a checkoff sheet, kind of like a competency form that shows what areas that they've achieved classroom instruction in. So she can follow them along to achieve that within the first year of their employment. And we have a lot of flexibility with that training, having our trainer on site. But obviously there's drawbacks here. There is, it's a big commitment. It's a lot of work for our trainer. She created all this curriculum from scratch and used different references and resources. She was able to work with our medical directors and some of the experts in the different departments to put it together. However, it was a lot of work, and I know a lot of hospitals, labs that don't have time, to have this dedicated person put this curriculum together. And then just finding somebody that's willing to be that instructor and put the time forth to do it. I happen to have an excellent trainer that's done exceptional work with our team, and we had a very high pass rate with our certification exams. Also, one of the drawbacks, which I didn't even think of being an issue, was the fact that our techs that went through the traditional route weren't always accepting of these non-certified techs. They give them somewhat of a hard time initially, knowing that it was a different route. They felt they weren't necessarily qualified for the work they were doing, even though they went through followed the same competency process that we had in the laboratory. They had to prove themselves competent before we allowed them to do the lab work independently. I think that's pretty much washed away with the non-certified techs proving their value and their ability to learn quickly and meet the work demands. So my trainer, as I mentioned before, Carolyn Hager, put her name out there. Excellent trainer, don't try to steal her. But she did an excellent job, putting this instruction together. She outlined the topics for the students, developed all the presentations. She identified appropriate textbooks, worked with medical directors to get some advice and opinions on that, worked with some experts, like I said, in the lab. She scheduled and worked with the managers as far as scheduling the classroom instruction, what time of the week, when of the week, they're on second or third shift, first shift, wherever this cat would go. She created timing for the classroom to work with the managers so they could have time on the lab, not interfering with that, but also making sure they get the classroom instruction as close to what they're working in as they can. Not always doable, but as best we can. And like I said, she's always rotating in new candidates as we hire. So we asked for some of the perspectives from the candidates. So the pro is, they like I mentioned before, like myself, way back when, is you get that college degree, you're not sure what you're going to do, but the clinical lab gives you a career opportunity that you may not have considered. And I think it's a great career, helping a lot of patients and people. And like I mentioned here, the cons, initially it's tough to pick up some of the laboratory lingo that you would normally get in a normal CLS program. But it didn't seem like it was too difficult for them to catch on. They had a strong biological chemical background, so it went fairly smoothly. It did take a little bit longer on the bench to gain competency because of this, but not anything I would consider to be significant detractors from them learning in the program. And then, like I mentioned before, some of the technical staff were frustrated the fact that they had to explain some of the basic things in the laboratory that they would assume that a person should know when they come in. One of my chemistry managers here, she mentioned some of her pros and cons associated with the program. Her being the manager that now inherits these non-certified techs, works with the trainer to fill the role. Like I mentioned, we had a lot of good candidates to fill the positions very quickly. The hands-on training, provided excellent support for them, and so on. I won't read it all. The cons, like I said before, they didn't understand some of the lingo. They required some additional training and time with the trainers. And I'm not sure it was all just non-certified techs. We're starting to see a greater churn, especially younger adult workers that are turning over lab more quickly. So there is a lot more training going on in the lab. This is the fact we're seeing a greater churn with staff. So that's a non-certified tech program. I'm sure I've generated a bunch of questions. I can certainly answer them in the Q&A. Another approach to addressing your staffing challenges is creating a medical lab assistant. Some of you already may have lab assistants in the lab that have gone that route years ago or haven't or considered it and weren't sure about it. It's an opportunity for folks with a high school education. They have interest in the lab, but didn't go through the educational route to gain, a MLT or a CLS. And what I'm affording them is an opportunity to get their foot in the door and learn about the lab. We have tuition reimbursement here at WDL, so we encourage these folks to go on to a MLT or CLS program, depending on where they want to go. As you can see here, the program requires a high school education. We expect to generally hire folks that have lab experience already in our processing area. We created the MLA to be basically a promotional opportunity over processing. So we have an MLA1 and MLA2 role. The MLA2, we have the expectation that you become a certified medical lab assistant through ACP or AMT. So that is a requirement in order to get promoted up to MLA2. So we want to hang that carrot in front of them. I think it's important to show that they've met this accredited, and I think they'll get more respect from their affiliates working within the laboratory. So my trainer is already created curriculum for this program. We're going to give them basic lab skills. They'll go on for several weeks as a part of their initial training in the laboratory. Also, the expectation is as they move up to level 2 role that they'll be able to support more than one department. They'll be able to support multiple departments. And the training will give them some background experience to support more than one department. The big key here is going to be immediate help in the laboratory. So if you're short clinical lab staff, MLAs can do a lot of the work that technical staff simply don't have time for, or you wanted them to focus in at the highest level of their education, which is result entry, troubleshooting, dealing with those difficult patient situations or specimens. Let this lab assistant run these samples around, set up calibration validation materials on the instrument. They just set it up. They don't validate it. That would be validated by a clinical lab scientist or an MLT. So that's the main intent of this, is to truly pick up a lot of the busy work, instrument maintenance, setting up instruments. There's a lot they can do. We've identified a lot of opportunities, as you'll see here. Here's the eligibility. I won't go through this in detail. Just give you the slide to take a look and gander. to see what this might entail as far as getting these folks certified within this. You can see you have to be an accredited laboratory, the CLIA, CAP, in our case, ISO will meet that requirement. Depending on their education level, as you can see here, it determines how long they have to be on the job before they're eligible for the exam. A lot of our processing folks have already been in the lab for several years, and in a sense meet a lot of the on the job experience already coming in. So this is my trainer put this together. This is the content of the exam. One thing we identified is there is phlebotomy information. We generally we're probably not going to have these folks do phlebotomy, but we're going to give them the classroom instruction, which I think is important to understand the pre-analytical, the front end part, that specimen collection and what that all entails, and getting a good quality sample. So I think it's valuable to have this knowledge and information. I'm noting a lot of clinical lab science programs are not focused in on phlebotomy any longer, which I think is an unfortunate situation because they don't always link the sample to the patient because they don't have a whole lot of that experience. So kind of a lost opportunity, but part of the examination. So we, like I mentioned before, we provide them classroom instruction. The intent is to really get them up to speed if they don't have that background and knowledge. I know processing folks, we hire a lot of high school graduates, not necessarily have much lab or science background, and they know how to handle the sample, but they don't always know the why behind it. So a big part of this is really learning the why and the understanding behind that sample, what it all means and where it came from, and to make sure they have that. Also, a continuing education program to support them as they move forward. And like I said, we're really trying to set a situation where they can rotate different areas where the greatest need is, depending on who has the most staffing shortage, who can benefit from the MLA work that day. Yep, you can see the two different exams, the AMT, ACP. I don't know if one's any better than the other, but they both offer a certification exam, available to the candidate. So Joel Menser, our micromolecular manager, they're again giving some feedback. So her positive feedback, she can select from qualified team members. So we generally expect to recruit within our processing staff that have some time in the lab, know our LIS system, they know how to handle samples, they know a lot about samples already, bring them an MLA role and pull them into the technical parts of the lab more so. And somebody that shows interest in that, we can further development. Like I said, it frees up technical team members and encourages further development for these folks, which we hope that they'll go on to further school and become an MLT or a CLS at some point. Here's some of the duties and roles and responsibilities that we figure they can support with. I mentioned some of this already. This kind of gives you more visual of what we're looking at these folks assisting with within the laboratory. As you can see here, this is a lot of the bulk of the work, I'm sure, your CLS or your MLT folks right now. This is another alternative. We don't require necessarily that certification up front, but they can get a lot of this work done in the laboratory if you're really short-staffed in certain areas in the laboratory. And so you may be already doing this and benefiting from it, which is great. Another perspective from our pre-analytical manager, Jonathan Smith. In this case, he's likely going to be the one that doesn't benefit so much from this program, meaning he's going to be our feeder source for these folks. But that's what he's all about. He's truly trying to ensure that these folks can grow in their career, and he's more encouraging on these folks. Some of the people that he works with in there are MLT or MLS students. So he gives them time in the processing area to get that, in the lab experience up front. So there is a benefit to the student, working towards this degree or certification as well. Let's see what time I got. Yep, we have about 4 minutes. So what I was focused on was some of the programs I put together in the last couple of years, but there's been other programs within WDL following in line with the non-certified tech program. So I didn't focus on histology. My histology manager, Chris Bradley, has developed a program where he works with LTAs in the lab, and he has progressive LTA 1, 2, 3, puts them through that training on the job and education, which allows them to be eligible for the HT, and if they have a bachelor's degree for the HTL, which he's been very successful. In fact, in his department in histology, he had a waiting list for staff members coming in, and he had to end his program because he didn't have a need for further HTs at the time. So, but he can bring his program up and down depending on what his lab needs are. So I think currently he had a couple folks rotate, so now he's bringing it back up where he's going to bring in some LTAs and develop them in the HT through his histology training program. Micromolecular, I didn't mention that before, but they've been doing this for years, but not any formalized manner. The folks brought in as a non-certified tech was kind of on their own. We have hired a trainer within the micro department that's putting together the classroom instruction and giving more formalized structure, having them follow the expectation that they become certified within the time period. And that's been a successful program. Micromolecular is largely more than half of the folks working in there have come through this type of program. Blood bank, I'm starting to gain buy-in from them. So currently they don't follow this program, but I think they're growing willingness with the staffing challenges they're having within that. Also, it opened up some networking opportunities. Shield of Illinois down in University of Illinois, Chicago, was putting together a CLDP program, clinical lab development program of their own, and we networked and worked with them. They're actually providing us with some train the trainer type curriculum that we can work with. If you have any interest in it, let me know. Also, what I've been doing nationwide is I've created what I call the WDL Education Collaborative. I want to put that out there. What it is I have speakers. I spoke about all the stuff that I've done, and I'm having my histo manager, Chris Bradley, speak at the next Education Collaborative. But I've had speakers from East Coast, West Coast, from all different laboratories throughout the country speaking about some of their staffing solutions. So this whole Education Collaborative is, once you get on this collaborative, we send you the invites to the next upcoming WebEx. It's generally an hour long, and you can just participate by listening in and see what other solutions folks are using. What I'm selling you may not work as best for your lab, but something that some other lab is working with. So I've had speakers each month through last year speaking about some of their alternative solutions, and it's been very successful. So if you have any interest in participating, there's no cost associated with it. It's just a free, you send your email message, hey, I want to be part of this, and then you're on that group forever. If you want to participate in an upcoming session, great. If you don't, you don't have to, but we send out all the materials that were presented at each of these WebEx conferences. So I encourage you, if you want to hear what others are doing throughout the country, this is a venue to do that. And it's a great way to network with folks throughout the country. I've been networking throughout, and started all this when I had people reach out to me after they read my article in Cap Today from August 2022. All right, I think I'm at the end here. This is my time is running at the end for now. We're moving into the question and answer, but these are the topics that we had covered. So do I just stop sharing my slides then? And
yeah, so yes, Mike, that would be great.
Okay.
Okay, we'll take a few minutes to answer as many questions as possible. If we do not answer your question today, we'll do our best to answer via email. That's if you haven't submitted that question anonymously. If you have any questions after today, feel free to email us at onelab@cdc.gov. Okay, let's see. I'll start with this one. Is the program open to international participants or laboratory participants? Because we have someone that's from Canada. They're just kind of
Yeah,
asking. Go ahead.
yeah, sure. No, boy, that is a really good question. I'd like to believe they are able to, I guess as long as they meet the educational requirements. So, um, I mean, I'd obviously be willing to hire, but I would have to verify through ACP if they meet the eligibility requirements to achieve the certification after the on-the-job experience. Which, as you are aware, if you go on the ACP site, they have multiple alternative approaches to achieving requirements to become ACP certified in a specialty that you're interested in. So I wouldn't give up on that. I would certainly give it a look at the ACP website and see what the eligibility requirements are. Because if that's the case, I think you would find interest in laboratories to do this work with you on that.
One other question. So the NCTs, do they start in just one department, or maybe limited to the testing? Do you let's see what else to say. Do they get an opportunity to actually until they reach their certification? I guess so. Are they starting just one area and then they're limited to the testing, and then as they progress, then they're able to actually kind of meet all the qualifications to be able to take the testing for certification?
Right. So what we do here is most of the people we hire in this program are for the core lab, which covers hematology and chemistry. And we train them in both areas. So we put them, since they meet CLIA 88 requirements to work in the laboratory, they meet that walking in the door. So we put them through the same on the bench competencies we do any tech. So once they achieve competency through our training, we allow them to work independently on the lab as they work. Then obviously they get paid as a non-certified tech, work as a non-certified tech until they're able to achieve the certification. So if they achieve certification in chemistry, we're not just limiting them to work in chemistry. As long as they achieve competency in the specialty area that they're trained in on the bench, they can perform that. We encourage them to gain both certifications over time. I think it's a benefit to them more so as well from a career perspective. Hopefully that answered your question.
Yes, it did. This is a really good one. How do you get approval for this type of program if your state has licensing requirements? So if your state has a license requirement, how are you able to actually get approval for a program like this?
that since Wisconsin doesn't have that, I'm not sure I can answer that question, but I guess my first thought would be to reach out to your licensure body in your state and see what those requirements might be. They might require you to have a NACLS accredited program, which we're not NACLS accredited, but it's not requirement to become ACP. You don't, in fact, you're not required to give them classroom instruction. ACP only requires the on-the-job experience with a certain meeting transcript requirements with a bachelor's degree. But your state licensure will probably let you know if you're eligible, if they're able to then certify or have them work in your laboratory based on what their licensure requirements are. I know it's a handful of states like New York, California. I know of two off the top of my head that may require special requirements for that.
Okay. Do you require have a minimum requirement for working time? For example, like 2 years to be in your lab. So I guess do they sign some type of agreement that they're going to work for at least a year?
Yeah, no, I get that question all the time, and no, we don't have any type of agreement with them. My main reasoning for that is I want the person to stay in our laboratory because they think this is the best lab and this is where they want to work. If they're unhappy and they want to go somewhere else, I prefer they go elsewhere than having a agreement where they're only sticking around because they're going to get charged a certain amount of money because they left early. Be honest with you, when I started in the lab, they had that hanging over my head. You know, I was going to stick around anyway. However, it was a negative approach to keeping people around. And I want them to stick around because they want to stay in our lab. They're motivated to work with us. And you're right. It from that perspective, you may call me dumb, because I'm putting all this time and effort, and I'm not expecting them to stick around. I guess time will tell who comes ahead in that scenario. But I think I will in the long run because I have only people working here that want to work here and really enjoy working here.
Yeah. Let's see. Oh, this is a good one also. Does the organization pay for the team member to take their certification exam?
So yes, we do. So we pay for the exam that they pass. If they take the exam and they fail it, we don't pay for a failed exam. We pay for the one-time passed exam. So obviously there again, motivation. If you pass, the exam gets paid for and you get a big pay increase. It's pretty significant. But if you fail the exam, we've had some of our candidates go into it kind of lackadaisical, not thinking they had to study much. Oh, I got this, and they learned the hard way, and we really want you to go in there and put all your efforts forth to make sure you're going to pass that exam. It's not an easy exam, as most of you know.
Yeah. Yeah, I was one of those who just went in there thinking, oh, I know this, I can do this. And yeah.
Yeah.
Do you have experience hiring IMGs?
IMG, I'm not sure what IMG stands for,
Yeah,
to be honest. It's what?
with it. So how do you recommend reaching college students who may not attend large universities with career fairs? Are online webinars effective, especially if recorded and have live Q&A?
Yeah, that's a good question because you got to find an audience. Can you get the audience of these folks to listen to any seminars? And that's something, if you have a smaller university or a university in your area that you're trying to reach, I would reach out to one of the faculty at this university and set up I think it's better in person, and that's what we do at the high schools, is actually, get one of your lab members that want to speak to the career and actually set up a time for them to actually speak to the university. And they could tape it, I suppose, and present it to others that aren't able to make it at that time. But I think that would be an effective way of reaching college students that are not sure what they want to do. They might be in a biology chemistry degree, and this is give them an alternative. We did a research poll at the Executive War College, and we found out of the people we polled, only one person actually was aware of clinical lab scientists before they graduated high school. Most of them found out it after high school or while they were in college. So that's, so it's important to try to get them so I think it's more important to get them at the high school level, get them interested in this field. We do a lot of job shadowing here at the laboratory. There's another way to get them. I've been making a lot of connections with the local high schools. We've been speaking at the high schools and offering, as we speak, opportunities to shadow in the laboratory. And then a lot of times these students take us up on it.
Yeah, this is we'll take this one last question, and I think it's a really good one.
Okay.
They said the information presented is definitely a step in the right direction, but seems to be aimed toward large facilities that have the staffing and capabilities to teach and train on the job. What suggestions do you have for smaller labs, such as critical access hospitals that do not have the resources to achieve that level of commitment?
No, yeah, that is a really good question. And that's the concern I have. And the main reason why I had put together that apprenticeship program, because I know a lot of the hospital labs don't have the size and abilities that I have. And working with the local university to get the education can be your solution for that. But it also requires, you on the job, educating them at the bench. And that, unfortunately, that's the nature of the animal. And you're going to start seeing more churn of younger adults in the workforce. So training is going to be part of it. I know it's difficult, and a lot of times these smaller hospital labs or clinics are associated with a larger hub hospital, the hub and spoke model. I think that's where the leaders in that organization need to come together and look to that larger laboratory to be kind of that resource in the ability, money wise and staffing wise, training wise, to help these smaller labs within their system to develop it. And that's one thing we're trying to do here at WDL. We're the large core lab of our network, and we have the ability to do a lot of these things and our opportunities to support our smaller hospital labs in this venture. But it's a different solution for all, and that's why I put the education collaborative together, because one size doesn't fit all. And that's one thing I'll work on, is trying to get a speaker from a smaller hospital and some of the things that they've done to help their situation with staffing.
Yeah. Well, I'd like to say thank you again, Mike, for
Sure.
presenting today. We'll hopefully have you back again for another One Lab Network event.
Oh, sure. I'd be more than happy. I appreciate you guys giving me this time and pass the word.
Absolutely.
We all are, yep. Lab people are all lab people, I've found. I've worked in a lot of labs over my years, and we all speak the language. We all get together really well, and we're all here to support each other. And that's what I'm about.
Absolutely.
Yep.
We are offering 1 PACE credit for today's webinar. PACE certificate are immediately available in the One Lab Reach in your My Learning Hub for easy access. To receive your PACE credit after participating in today's session, you'll need to log into your One Lab Reach account. You can go ahead and visit the link in the chat and use the passcode to complete the evaluation within 2 weeks. Just to note, you must actually be logged into your One Lab Reach account to access the evaluation. This slide will actually remain up for like 5 minutes after today's session. If you missed the link in the passcode after we have closed out the session, please email us at onelab@cdc.gov for assistance. Next, okay. We would like to highlight the upcoming July One Lab Network event briefly. This event is the newborn screening system and the role of quality assessment and technical assistance from CDC. It will be presented by Dr. Carla Cuthbert. She's the branch chief of the newborn screening and molecular biology branch here at CDC. The date and time and the link and registration are coming soon. So look for email or visit us at the One Lab Reach platform. As a reminder, the slides and audio recording of this event will be posted to our website within the next 2 weeks from today. Lastly, I encourage you to utilize the One Lab inbox to share your training needs, feedback on One Lab events with us. We use this input to select event topics and understand the laboratory community's needs better. The One Lab email address is posted in the chat for easy access. Again, it's really simple. It's onelab@cdc.gov. Again, thank you for joining and have a great rest of your day.